Okay, good morning everyone. So we have a busy day ahead of us and we have a nice small group today on the unit.
I'm excited.
Yes, I know. So this is your 5th week on the floor, and I know you've looked up your patients last night and then you've reviewed vital signs, labs, new orders this morning. Okay, and I see you have notes on your patients, so we will go through your patients individually. I know you've prepared an S-bar for pre-conference, which is great. But first, before we get started, I just want to remind you that this week is domain number 4, so Scholarship for Nursing Discipline for the AACN Essentials. And I know as pre-licensure nursing students, you're probably thinking at this point, scholarship? Like, I just want to give meds, give my patient a bath, get them out of bed, right? But these are some really important things that we still need to be thinking about. So this will be our theme for today. So, while we get started, I want you to think about some sort of learning opportunities that maybe you've seen on the unit as students, as you sort of walked around and seen things on this floor. Have you seen anything about sort of current evidence or quality improvement initiatives that have maybe taken place on this unit since we've been here?
I don't know if this is what you mean, if this is what you're looking for, but I think I saw something about like a checklist for catheters, I want to say,
Yep.
and then I think, was there another one about falls?
Yes.
Okay.
Yeah, exactly. So those are great answers. Exactly. So the catheter bundle that prevents infections. We all know about falls and the fall protocol, and those are things that we really track on all units. Things like central line infections, all of those things are really important. So you've likely seen the bulletin board down the hall that lists all of that. So today I want you to really take a moment, if you have downtime, to look at those numbers, and then we will talk later about what those numbers mean. So what's maybe one clinical question that you've had that could be explored through research or quality improvement that you've seen while you've been on the unit here? Something that sort of triggered your thoughts there. Anything that comes to mind?
Well, I remember I took care of some patients who had surgeries, and they actually all had the same type of surgery, but then when I worked with them, they each had different level of pain, and they experienced pain differently, and they even were on different levels, doses of medication. So
Yes.
maybe something like that.
That's excellent. And those are the things, those sorts of observations that you've just noticed, same surgery, but different levels of pain, that's really what drives improvement. So that's an excellent observation. Great. So really students like all of you can help by noticing these patterns and, asking those questions. So that brings me to something actually really important that I want to talk about today is, when you think about system inequities, how do you think system inequities affect research and clinical practice? And what roles do all of us as nurses have in addressing those?
I'm not sure what you mean.
Yeah, that's okay. No worries. This is something we'll talk about today. So things like language barriers. So I know last week, Yulika, you had a patient where English was their second language and we used the interpreter. So things like language barriers, cultural differences, those are things that can make it harder for some patients to get quality care. So we'll explore this as the day goes on. So please be sure to check out the bulletin board and we will touch base later today. Okay? Okay, so let's go. Kate, how about we start with your patient if you want to just give us a quick S-bar.
Sure. Mr. Johnson is a 58-year-old male who came to the hospital with shortness of breath last night.